Welcome to the Oklahoma Low Back Pain Today, patient-centered education podcast. This podcast is a production of the Spine and Joint Treatment Specialists at Elite Pain and Health, a leading independent Oklahoma spine and joint specialist treatment clinic. This episode is produced and directed by Dr. Keely John Booth, MD, and provides valuable insights for patients wanting to learn more about lumbar or low back pain. All information is for educational purposes only and should not be used in place of an evaluation with an experienced licensed medical professional. You can reach out to Elite Pain and Health at epainhealth.com or call 405-444-7246 for more information. Okay, so today we're jumping into something I think a lot of people have felt. That weird sensation like your leg is asleep, but it just refuses to wake up.
Or that zapping feeling like you've just been hit by a little jolt of electricity.
Exactly. That numbness, the tingling, sometimes even weakness. Yeah. And the thing is, you think it's a leg problem.
It feels like a leg problem, but, the source material is really clear. This is almost always a back problem.
So how does that work? How does my back make my foot feel dead?
Well, the best way to think about it is like the electrical wiring in your house. The brain is the main fuse box.
Okay.
And the spinal cord is that big main cable running through the walls, the nerve roots that come off it. Those are the wires going to specific rooms, like your leg.
And the biggest wire in this whole setup is the sciatic nerve.
That's the one. It's the longest nerve in the body. Goes all the way from the lower spine down to your toes. So if that wiring gets pinched, what we doctors call radiculopathy, the signaling gets all scrambled up.
A pinched nerve. And what's doing the pinching?
Usually it's something mechanical. You see this jelly donut analogy a lot because it's just so perfect for explaining a herniated disc.
The jelly donut. I like it.
Yeah, so your disc has this tough outside and a soft jelly-like center. If you get a tear in the outside, that jelly can squeeze out and press right on the nerve.
And that's really common for folks under 50, right? But what about for, say, older Oklahomans?
Right. For people over 50, we start to see more spinal stenosis. It's really just a natural narrowing of the spaces inside your spine. It starts to squeeze those nerves, kind of like a kink in a garden hose.
And the symptoms are, they're not just pain.
Not at all. It can be that pins and needles feeling, a burning sensation, or even serious weakness. There's a condition called foot drop.
Foot drop.
Yeah, it's where you literally can't lift the front part of your foot. So you might find yourself tripping over rugs, stumbling. It's a big deal.
And what's wild is that the location of the symptom is like a map.
It is. It's like detective work, where you feel it tells us almost exactly which nerve is the culprit. For example, if you have numbness on the front of your thigh, we're thinking it's probably the L4 nerve.
L4. And what if it's the big toe that's acting up?
That points us directly to the L5 nerve. And if it's the heel or the little toe side of the foot, that's usually S1. It takes a lot of the guesswork out of it.
Okay, but we have to pause here. There's a huge red flag, a safety warning we need to talk about.
Yes, absolutely. This is the do not wait, go to the ER moment. If you ever experience numbness in the groin area, what we call saddle anesthesia, like the parts that would touch a saddle.
Or a loss of bladder or bowel control.
Right. That is a true medical emergency. It could be cauda equina syndrome, and you need to call 911 or get to an emergency room immediately to prevent permanent damage.
Okay, so assuming it's not that emergency situation, how do you diagnose the regular jelly donut problem?
Well, it starts with a good physical exam. We'll check your reflexes, maybe do a straight leg raise test. But to really see what's going on, an MRI is the heavy hitter.
That's magnetic resonance imaging, the one with the big magnets.
Exactly. No radiation. It's fantastic for seeing the soft tissues, the discs, and the nerves themselves. A CT scan is better for looking at bones.
And I've heard of things like an EMG.
Yep. An EMG or an NCS. Think of those as speedometers for your nerves. They measure how fast the electrical signal is traveling. If it's slow, we know there's a problem.
So once you've found the spot, what's the treatment plan look like?
The philosophy is all about a stepped approach. You always start with the least invasive thing first.
And you don't just jump to surgery.
Oh, no. In fact, 80 to 90% of people get better without it. We start with activity modification, maybe don't sit for 4 hours straight and maybe some anti-inflammatory medications. And physical therapy is the cornerstone, truly.
What's the next step up if that doesn't quite do it?
The next step is often what's called an epidural steroid injection or an ESI. We use image guidance to put a powerful anti-inflammatory medicine right at the source of the problem, right around that irritated nerve.
It's like putting the medicine exactly where it needs to go.
Precisely. To calm things down so the body can heal. Surgery, like a microdiscectomy or a laminectomy, that's really reserved for cases where nothing else works or if that weakness is getting progressively worse.
So I think the biggest takeaway here is that you have to be patient.
You do. Nerves heal very slowly. But the other key is not to wait too long to get it checked out. Early treatment can prevent that damage from becoming permanent.
We hope this episode helped you understand leg numbness, tingling, and weakness. If you're experiencing these symptoms, you don't have to live with pain. The specialists at Elite Pain and Health are here to help. Visit epainhealth.com or call 405-444-7246. Thank you for listening to Oklahoma Low Back Pain today. Take care of your spine, Oklahoma. We'll see you next time.